Hello, I'm Dr. Maria Sulindro, specialized in integrative anti-aging, practicing in Pasadena, California. Today, I would like to share with you somewhat of I know about the seasonal affective disorder. So, some of you might have known about what is seasonal affective disorder, or the abbreviation is SAD or SAD. So today I'm going to see if we can cover what is the prevalence, who gets these situations, or what are the symptoms, and what are the treatments, and is there a preventive measures. Do you will if you feel down during winter months, and if or you feel like you take like double or triple efforts to do something that you usually do, if so, you might have what we call seasonal depression, also known as seasonal affective disorder. Seasonal depression is a mood disorder that happened every year at the same time. This seasonal affective disorder is not a major depression, but it is a form of depression. Another rare, that is very rare, is a form called summer depressions. Begins in the late spring or early summer, and it ends in the fall. So it's the opposite. In general, the seasonal affective disorder starts in fall or winter when it's more dark than light, and end in spring or early summer. It is affecting 3% of the populations in United States. So that's about 10 million people. That's a lot of people. And up to 15% of people who has a major depression has these seasonal affective disorder symptoms. Anyone can get it no matter of their age. People who live further up north from the equator has more cases, so it's more to the north. But unusual that the Scandinavian is considered the happiest people in the world, even though they have less light in their country. So the scientists said this must be either their genes or their epigenome or epigenetic. So as you know, epigenetic is anything but the gene, right? So it's environment and lifestyle. What are the causes of this seasonal affective disorder? No one knows the real cause, but some scientists still think that it's related to the hormonal changes. It's not the same as the imbalance hormone that we have. It is a little bit different. These people are more sensitive to the season or to the light that they get. So another theory is that less sunlight during the fall and winter leads to the brain making less serotonin. As we know, serotonin is happy hormone. The feeling can be depression, along with symptoms of fatigue or tiredness and weight gain. Usually it starts in the young adulthood, more common in women than men. Some has irritable feeling and interference with the relationship of their coworkers and their family members. So they actually have some problems at work because they are very irritable. It is uncommon to occur in countries where there is plenty of sunshine all year round. Symptoms during winter usually covers less energy, so they feel fatigue, unusually tired, trouble concentrating. They have greater appetite and they eat more. They gain weight and craving for carbohydrate. social withdrawal, feel sleepy all the time, they need more sleeps than usual. The summer depression is the opposite. They have less appetite associated with weight loss because they don't eat as much. Insomnia, they cannot sleep. Agitated, restlessness, they have a lot of anxiety, and they have episodes of violent behavior. What's the treatment? Okay. In my practice, because I'm a specialist, I usually get patients who come with their diagnosis already. They said, I have seasonal affective disorder, and they usually know what to do with their treatment. However, since the treatment is always personalized, what I mean by personalized is you have to also know their health conditions, and then you have to treat their health condition so it will help to lessen the symptoms of seasonal affective disorder. Patients with these situations do not have the same symptoms. They might have to be seen by a psychologist who usually do the testing to confirm the diagnosis. There is a special test to differentiate between seasonal affective disorder and other depressions. Treatment can be several treatments, right? The first one can be medication. There is one medication that is approved by the FDA. It is considered as antidepressant. It's called bupropion. And this medication specifically actually to prevent these patients to go further, prevent for having major or massive depressions episodes. So other supplementation can be also helpful. Those are L-tryptophan, melatonin, and some of them they also need to check if they do not have too much melatonin. Basically, activities, exercise does help. So we encourage the patients to routinely daily exercise, active and doing other works as well, such as gardening outside in the morning where there is daylight. Many doctors will say and recommend the people that have a seasonal affective disorder get outside early in the morning to get more of natural light. Next one is called cognitive behavioral therapy. It's positive thought, and you exercise the positive behavior activation. The psychologists teach them how to do this. According to the study, the CBT or cognitive behavioral therapy is superior to the light therapy alone. And light therapy is very famous. Everyone would like to have that Lightbox. It comes with a big size before, as a little bigger than your computer, or now it comes as the size of your laptop, or some of them it comes as the size of this, and then you just turn it on and put it next to you. Yeah. So this light therapy, there are several kinds. The phototherapy also helps. There is mood changes when sunlight is available in winter. Natural or full spectrum light can have antidepressant effects. The full spectrum bright light shines indirectly into your eyes. So do not shine directly, so indirectly. The lights especially used for the seasonal affective disorder is called lux light lamp. They filter the ultraviolet, and they measure the lux. It's 10,000 lux. What is recommended for this problem? You sit about 2 feet away from the bright light, about 20 times brighter than your normal room lighting. The therapy starts with 10 to 15 minutes a se- sessions per day. Then the time increase to 30 to 45 minutes a day, depending to your response. Why can't we sit too long? Well, this one can set your biorhythm in your body. So if you have too much of the light, you might have difficulties falling asleep, or you will wake up too late and then you miss the morning light. Don't look directly to the light source of any light box for a long time, because who knows, there is still the ultraviolet that will possibly damage your eyes. If you use LED, the light emitting diodes, it's 20 to 30 minutes twice a day. Some people with seasonal affective disorder recover within days of using this light therapy. Others take much longer. But if seasonal affective disorder symptoms don't go away, your doctor may increase the light therapy sessions to maybe twice a day. If your doctor recommends light therapy, ask if they provide this one, or if they would. It doesn't require any prescriptions. You can just go to Amazon or Google it, and you can buy this light from them. It used to be very expensive, a few $100, but now it's only like, $40 to $80. I checked the other day, and you can get it as low as for $49 for 10,000 lux. You you can also ask your insurance company first. With a specific diagnosis, your health insurance may cover it. People who respond to light therapy are encouraged to continue until they can be out in the sunshine again in the springtime. While the side effect of the light therapy is minimal, just be cautious. If you have sensitive skin, it can irritate the skin, and also if you have history of bipolar disorder. Can we prevent this seasonal affective disorder? I think so. And it has been proven that if you spend sometimes outside every day, even when it's cloudy, the effect of daylight still helps. Begin using the 10,000 lux light box when fall season start, even before you feel the effect of winter seasonal affective disorder. You have to eat well, balanced diet. This will help you have more energy, because you will have a tendency to feel fatigued and tired. And if you're craving for starchy and sweet food, still try to eat well balanced diet. Exercise for at least 30 minutes a day. 30 minutes a day exercise is not much, but just do it 5 times a week minimum, right? So stay involved with your social circle. It's very important. And do your regular activities. Social support is very important. If you don't have family support, you make sure you have a few friends who understand your situations, and they can help you just by talking and do something with them, like gardening, or it's even go out for breakfast and things like that. When should you call your doctor? Don't call them too late. The seasonal affective disorder is usually seen and managed by your primary care physician. It doesn't have to be a psychiatrist. So if you feel depressed, fatigued, irritable, at the same time every year, like during the fall, and this feeling seems to be seasonal in nature, you may have a form of seasonal affective disorder. So talk openly to your doctor about your follow their recommendation for lifestyle changes and treatment. There is a place in the brain, it's called SCN, suprachiasm nucleus, is where the melatonin is produced when the darkness comes. Usually when you close your eyes at night, you dim your lights, dark, then your melatonin is produced. It is almost like too much melatonin, as you get more sensitive to darkness, right? So so the body feel like you need serotonin, which is the happy hormone. So serotonin, usually you get it from your gut, your intestine. So that's the reason why people are happy after they eat, because they get more serotonin. So they have a tendency to eat more. They think if they eat, they feel happy because the serotonin is produced. They call it emotional eater. During the pandemic, like what we are having now, some people lost their job. They have to stay at home, lockdown. Like in Los Angeles, now we have a lockdown again. They feel sad. People feel sad and trapped at home. Some of them now are feeling more likely they have a depressions. Good news is that they have their primary care physician who will or help evaluate their situations and start treating them, hopefully. Some testing needs to be done to assure the diagnosis is as many as, because as of them similar to symptoms that overlaps with major depression, bipolar disorder, hormonal imbalance syndrome. Therefore, the patients might need to see a psychologist whose major function is doing all the testing. Some psychologists will find out that the result is pretty severe or unusual or unlike the seasonal affective disorder. It's more than that. So they require more helps, maybe chemical intervention such as prescription medications. Now, you know, psychologists, they do not prescribe, but psychiatrists prescribe. They are then referred by their primary care who sees that. And if they cannot handle it, they will definitely send them to psychiatrists who will confirm the diagnosis and give proper medication. Otherwise, the primary care themselves can take care if it is just seasonal affective disorder. This will be helpful for the patients to understand some symptoms that they are having, and they can really talk to the doctor and just make sure that they get help. Many people who feel sad because of COVID, where their lifestyle is forced, and this make people have what we call just, disappointment, I guess, right? With the holiday seasons coming up. What is in the holiday seasons except Thanksgiving, Christmas, and New Year, right? Well, but COVID now is here, so we cannot spend time with our family. We cannot go to church. Some places don't allow the church to open. So COVID is increasing now. People will have a tendency to feel disappointed as their natural outgoing habit is inhibited. They feel very unhappy. They cook at home, so they might eat more also because their other activities are limited. The fitness center is closed, so they have to exercise at home. It's a little different. But this kind of sadness is not related to the deprive in serotonin or overload of melatonin where the seasonal affective disorder has. So this is not that kind of condition. This is just simply due to situational that is prolonged, that is not affected by darkness or light. Overall, I would say that lifestyles where they have to be connected to our social context and continue to be active, even if we cannot go to school or go to work, we need to continue to practice positive thinking and also eat balanced diet and take a good supplements. We don't have to gain weight, right? And continue to learn how to stay healthy. I take a couple questions now. Any particular brand of the Lightbox? Well, last night, Nature Bright, Sun Touch Plus, Verilux, Happy Light, okay, Philips Go Light, something like that, range from $40 to $250. Some are just as big as your cell phone, and some as big as a laptop, like I said. So it's the modern one is very good. Okay, just a second. And then, is there any other questions? Can someone use Lightbox to treat jet lag? Yes, someone can use that. Light is a treatment of circadian system in your body, and so jet lag is a abnormal circadian system. So yes, it can treat jet lag. How about insomnia? Yes, it can treat insomnia. Do we need to have a prescription to buy Lightbox? No, we don't need a prescription to buy Lightbox. How much TV's bright light affects seasonal affective disorder? Television is not the same as a Lux box light. A television is a totally different light and it's not the same. So I don't know the measurement, but this kind of box, Victor, is measured by the lux, Lux, and it's a 10,000 lux. And you have to be mindful about the minutes. So you can sit while you're doing something or cooking or whatever, just turn on that light so it's not indirectly, and you start with 10 to 15 minutes and then 30 minutes if not enough, and then it can go to 45 minutes or twice a day. Okay, so I think thank you very much for joining me, and hopefully this month I would discuss more about next one will be anxiety, and the following after that will be I think I'm going to discuss about insomnia. Okay, so thank you so much. I'm Dr. Maria Sulindro, specialized in integrative anti-aging medicine, practicing in Pasadena, California.